evening, all of you. Friends, this is a very important session. I think Dr. Srinivasulu has set the context, highlighting very important issues to talk about the awareness and not to look at only the content as such, but also other important issues. I would just want to add a couple of points before I move on to the panel. One is about the community engagement. You know, when we talk about cancer, we talk about hope, but I think there's a lot of fear also along with this, because the moment you have cancer, there's a fear. And what's the role? Is it just the hospitals, but also there are a lot of NGOs, there are a lot of other alternative medicine they're all doing. So I would like to compliment FTCCA first for bringing together this panel. This type of panel will never usually happens, where you have actually, where you have Ayurveda, you have Unani, you have naturopathy, you have NGOs, you have Sparsh Hospice, a very eminent set of panelists talking about a common subject. And at the end of the day, what we should try and achieve is to get some common insights. We don't need to reinvent the wheel. There could be great learnings. There could be learning insights where we can actually replicate. So with these few words, I would like to start the panel discussion. Each panelist can maybe talk for 5 to 6 minutes, and then later we can open it up for questions. So I now request Dr. ROHINI Reganti, medical oncologist and palliative care expert of Sparsh Hospice, to start.
Good evening, everyone. This is my privilege, able to talk about palliative care and hospice, since other members will be talking about cancer screening and also diagnosis. I feel palliative care is a very specialized type of medicine which is given for any life-limiting disease of the patient when their symptoms are not able to be controlled by regular methods. So palliative care is very, very important as a part of the treatment along with the traditional cancer treatments. There is a definite statistical improvement if a patient of receiving chemotherapy or radiation, if simultaneously palliative care is also added to the care, they do better, their quality of life is better. The reason being, the palliative care not only just treat the symptoms, physical symptoms, it supports emotional support as well as family support, spiritual. So they take away the burden of diagnosis and helps the patient to have a very smooth ride during the treatment methods. So palliative care, who always asks, nobody is aware of palliative care. What is this, a new branch? This is a very upcoming branch. Now more people are coming to know about this. Previously no one knew about this. So one of the centers in Hyderabad, that's where I work, I'm Sparsh Hospice. I'm proud to be a staff member in that hospice. The specialty of Sparsh Hospice is, here all the treatments are given for free of cost. And so we give a patient, whenever patient is admitted, free medical care, free stay, free food, and also family counseling, social evaluation, and also we give help for the family member to stay with the patient. We all know majority of the cancer patients die in ICUs, where they don't have any family member with them and they die alone. We believe people should never leave this world being alone. They have to live with dignity and they have to pass away with dignity. This is the most important thing in everyone's life. So cancer treatments, when we talk about it, it's not just limited with the chemotherapy and radiation therapy. Palliative care should be given as an option, one of the treatment. So the patient have a right to choose which type of treatment they can take. So many times what we come across is lot of hospitals, I'm not questioning anyone, but we don't get referrals till very late stage of the patient. Sometimes we have ambulances bring the patient and patient expires as soon as we take the patient to the room. If this patient was given a chance at the time of diagnosis, or a patient was critical, that they're not going to be helped by any other further treatment, we could have helped the patient to have a very peaceful death or peaceful symptom control. but it is not done. So I think the awareness is not only about cancer treatments, it should be awareness of palliative care and end-of-life care. And these kind of services needed very much in Telangana or all over the country, because number of patients, cancer patients who goes through the treatment, we get a small percentage of patients to our care. So this needs to be addressed in every hospital. I also think palliative care needs to be introduced in the college, where people who are studying med school, they should not only have an idea about the disease part, they also should know how to take care of a patient as a human. So that kindness should be developed along with educational part. So briefly, in what we do in SPARSH, when we have a patient, we evaluate the patient, we talk to the family, we give detailed information about the care we are going to give, and then we give the choice to the patient when the patient wants to be admitted there or treated as an outpatient or home care. We provide all the services. When patient is in acute pain, the treatments, medical part of the treatment is done by the doctor, but then social workers do the social counseling, and we have psychologists who address the patient needs. Sometimes the pain is not limited to the physical body. It is also a lot of pain for things like they're blaming themselves, whether they got this disease because they have done something wrong. We call that as a spiritual pain. So we do the counseling, and they have a lot of emotional burden on their shoulders because they feel like they're going to die without finishing their whatever they're supposed to do, like having children, get married or settle the children. So this kind of fears, when someone is in the last stage of life, leaving this world is very difficult. So we kind of try to find out what is causing them this kind of stress and how we can help them by coordinating their feelings and trying to at least to satisfy them with few remedies, and also have the family able to cope with it. And we also, what we do is when we lose the patient, we don't leave the family. We follow them for 1 year. It's called bereavement program. We make calls every 1 month or 2 weeks like that, and then we follow up on them. And so if they need any help, the social workers will go to their house and help them. And not only that, we help them if some people don't have money for funeral services, we help them with that, for transportation, as well as Mahaprasthanam kindly agrees to do a free funeral for the patients. So hospice and palliative care looks scary because people think once you come there, you're going to die. But what is death? Everybody is going to die. How do you want to die? You want to die with dignity. So that is the most important thing. So not only cancer patients, we take care of any patients who have very life-limiting disease like cardiac failure, renal failure, respiratory failure, neurological diseases. So we are equipped to take care of any type of patients. If you can spread this word to your friends and families or neighbors, we are there in Kajagoda, right next to Oak Ridge. We would be very happy to receive anyone who needs this care. Thank you.